Hello everyone, welcome back for class 9 Why Do We Fall Ill? And our today's topic is types of diseases. And today in this video, we will be discussing difference between acute diseases and chronic diseases. So let's start. We will be starting types of diseases. So let's do first acute disease, right? So what are acute diseases? The diseases which occur in the body for a shorter lifespan. Time span is very short. Clear? How it is very short means it may remain with the body maybe 2 to 7 days, or sometimes, like in case of bone fracture, it may be for a month or more than a month, right? Because that healing requires, but its impact is not for a longer term. So first point is the time span. Second is this disease occurs in the body. It means onset of this body is sudden or rapid. For example, if we take common flu, it is something all of a sudden you may feel there is a running nose. You may have running nose, sneezing or coughing or headache. But this common flu stays there only for a week or 2 days and it goes away. You will not say, ma'am, I'm not able to give exam because 3 months ago I had a common flu. Won't it look funny? Yeah, it would look funny because it is a acute disease. Next is, even you cannot say, ma'am, last year I had bone fracture of my arm. Now I cannot write the answer. So please excuse me, and you are coming up with a leave. So what will happen in the class? It will be a big ha ha ha, right? So next point for this acute disease is that its impact on the body. Again, same, you cannot come with a leave. Its impact on the body is only for a short time. It means only for the time till the disease is there in the body. So besides common flu, we have another examples like stomach infection. That is also a kind of acute disease. Then bone fracture, again it is a kind of acute disease. Even malaria or dengue, normally you call it as dengue. It's a dengue. So malaria is also a kind of acute disease. Now let's shift to chronic disease. Now chronic disease is just opposite to the acute disease. The time period is longer than that. So on the basis of time span, it remains in the body or it affects a body for the longer period of time, right? For the longer period of time. And we can take the example here, hypertension. Hypertension, normally in the normal language, people call it as a blood pressure. So actually it is the hypertension. Now this hypertension remains with the patient if the patient develops this disease for a longer period of time or for the whole life also, right? Next is this disease, it does not occur suddenly as in the case of acute. It takes time to develop. It takes time to develop in the body. How? Because suddenly a person will not come to you that yesterday he was okay and today he is having a hypertension. This disease might have, you can say, the body, the arteries of the body, the blockage in the artery due to which the hypertension is there, it might have taken slowly and slowly due to the lifestyle. The person may be having the wrong eating habits or the person may be having the stressful life. Then because of this, there may be blockage in the artery and this kind of disease, it develops. So next is the impact in the body, impact on the body. It is, I will write here, the impact on the body, again it is for a longer time, maybe for the, you can say, whole life, and it may have a very bad effect. How? Because this hypertension, if the person is not taking care of it properly under the, you can say, medical practitioner, then it may lead to brain hemorrhage also. It may lead to brain hemorrhage. So it may lead to loss of any organ also, loss of eye because of the sudden bursting of the blood vessels in the body. So we can say chronic diseases are for a longer period of time. Another examples of chronic diseases are, they can be AIDS, then it can be some like diabetes and sickle cell anemia. So all these diseases, sickle cell anemia is a disease which is a genetical disorder. So like AIDS and diabetes, sickle cell anemia, you can see these diseases does not occur in one night or all of a sudden. It takes time to develop in the body. Onset is very slow. Now let's have a quick recap. Acute diseases and chronic diseases. As per the duration of the time, it's for a shorter period of time, and chronic for a longer period of time. An onset of disease. Acute disease takes in the body, it comes suddenly or rapidly, and as far as chronic disease, it takes time to develop inside the body. And next is its impact. Impact of acute disease is for a lesser time and goes away easily. For a chronic disease, impact is to a greater extent and maybe for a lifetime. Examples we have discussed earlier. Now, example of acute diseases are common flu, bone fracture, maybe stomach infection. But in case of chronic disease, hypertension, cancer, you can add AIDS, or you can add even that is a diabetes. So with this we come to the end of this video, and wait for the next video in which we will be discussing communicable and non-communicable diseases along with infectious and non-infectious diseases. Hope you have liked it. Have a nice day, and do subscribe the channel if you haven't till now, and like and comment in the comment section. Thank you.